All right, welcome back to Pharmacist on Call. Your host, Dr. Sean Pruitt. Your doctors are busy, your pharmacists are busy. They don't have time for this hour. I do. So you call in with those questions and those comments. I believe we lost a caller during the break, and she had a question about, I guess, basically treatments for neuropathy. So what neuropathy is, for those of you who do not know, it is nerve pain, and there are a different variety of reasons why this happens. You could have had damage to your back, spinal injury, and it's compressing upon a nerve. You could have situations where you post-herpetic neuralgia, which is nerve pain, post herpes, or what is the got too much knowledge up here, it's all jumbling together. Shingles, sorry. So you'll have neuralgia, nerve pain from shingles, and then certainly for those of you who are diabetics, you'll have diabetic, which is peripheral neuropathy throughout your fingers and your toes. So there are a variety of treatments out there for that. The conventional ones, gabapentin is going to be number one. So it comes in from 100, 300, up to 800 milligram tablets. It started out as an anti-seizure medication, and so what they noticed is that it slowed down the transmission of the nerves, but those patients also had benefit from nerve pain. And then you also have Lyrica, and I'm sure many of you have probably heard of it. So it is pregabalin, works on the GABA receptors, I believe. So it's going to be the new kid on the block. A number of patients have said that they have had a lot of psychiatric side effects from it, and so, you know, we use a little bit of Lyrica in my practice, but by and large, gabapentin seems to be the gold standard in terms of what most people are taking for neuropathy across the line, whether it's for shingles or diabetes or back injury. We're going to get right into your calls here. We've got Chanel on line one. Chanel, welcome to Pharmacist on Call. How may we help you?
Yes, I was calling about medications that my mom is taking for high cholesterol.
Yes, ma'am.
Do you think that, wait a minute, I've got to turn the television down.
Yes, ma'am.
Are there any natural alternatives?
For cholesterol, what medication is she taking?
One of the statins.
Okay.
I don't know which one.
Okay. Well, there are a couple that come to mind, and there are others, but just the first two that come to mind. One is called red yeast rice. Mm-hmm. And it basically, it is an herb, but what happens is the liver modifies it and changes it to a statin. So that's how it does its work. So you'll still have the same precautions that you'll have with the statins. Mm-hmm. Excuse me. So her liver function test will need to be monitored. Basically quarterly, and that's the AST and the ALT, to make sure that her liver function is fine, and to monitor her for muscle soreness, which is the rhabdomyolysis, which is a common side effect, and kind of lets us know we need to either back off or change her therapy. She can also look at gemfibrozil, but I believe it's for triglycerides only. And if you want to go a natural route, then you could go Garcinia cambogia, which is actually a weight loss substance that I also recommend. It seems to block the absorption of fat and cholesterol as well, but it also cuts off the appetite. It also has like a natural antidepressant effect. So many people have benefited from it. So I would look at probably either Garcinia or red yeast rice, but leave her on her current cholesterol therapy, especially if she's a diabetic. You know, kind of the standard of therapy is that she needs to be on something to quickly control her cholesterol. And you could probably take the Garcinia cambogia up until her cholesterol gets so low that she could come off of it. But she does not need to discontinue using the statin. You follow me?
Yes.
Okay. All right. That kind of answer your question?
Yes, sir, it does.
Yes, ma'am. All right. Thank you.
Thank you so much.
All right. Thank you. All right. Bye-bye. All right. Line two, we got Josh. Joshua, welcome to Pharmacist on Call. How may we help you?
Every time I eat something or cough, I throw up, then I'm not getting bad everything I eat.
Every time you eat, you throw up?
Every time I eat something or cough, I throw up, then
okay, could you
I'm not getting bad.
Hey, Josh, would you turn your TV down a little bit there, sir?
Yeah.
All right.
Yes.
Have you ever been diagnosed with acid reflux?
I I never know. I don't think so.
Okay, you diabetic?
I don't know that either.
Okay, does your stomach ever feel like really full, like it's full of air or something? It's really tight? Turn your television down there a little bit for us, Joshua.
Yes, it hurts sometimes. My stomach does. But I mean, when I take medicine to get better, I'm not getting better at all.
What medication are you taking?
Sorry, what medicine I'm taking?
Yes, sir.
I'm taking Finnegan and another medicine called is for infection.
Dexilent?
No, something P.
Oh, promethazine, Finnegan? Or Prilosec?
And amoxicillin. I take that to get better, and all that medicine is not helping me get better.
Okay, sounds like they may have had you on an H. pylori regimen, which, okay. So I'm guessing a couple of things. You either have a gastroparesis, reflux. Those would make me, based on the symptoms that you're telling me. How much water are you drinking every day? Do you go to the bathroom regularly?
Yes.
Number 2, regularly?
Yes.
Okay. Yeah, that's really odd. So based on what you're telling me, so have you taken amoxicillin, Prilosec, and maybe this metronidazole or something like that?
Yeah, that's really odd. So based on what you're telling me, but yeah, you still there?
Do they have you taking 3 medications at one time for it?
No. Yesterday, a day ago, I took my medicine for the infection.
Okay.
I took some medicine that was for infection in my in the Finnegan, and yesterday it made me really dizzy and nervous.
Okay. Are those the only medications that you're taking?
Yes.
Okay. Now, what type of infection did you have?
They said one day I had a flu.
Okay.
And they said I had strep throat when I went the first time, but I'm not getting better.
Okay, so you basically have the flu?
Yes.
Yeah, amoxicillin is not going to cut it.
It's not?
No, sir. No. So what else are you doing to help you with the flu here?
Taking cough medicine, and taking nighttime medicine and nighttime stuff.
Okay. Okay, do that. Continue that. You're gonna probably need you some vitamin C and some vitamin D, and what that's gonna do is help. Vitamin C and vitamin D. They're going to help your immune system fight off the flu. The amoxicillin is an antibiotic, so the flu is a virus, and so the amoxicillin is not going to have any effect against that. So I'm not sure why they gave you that unless they thought it was something else.
Vitamin C, vitamin D.
So, yeah.
Both vitamin C and vitamin D. Yeah, at least 1,000 milligrams of vitamin C twice a day.
Okay.
Vitamin D, I'd say, since you sound like you're pretty sick, let's do about 5,000 or 10,000 international units twice a day.
Yeah, at least 1,000 milligrams of vitamin C twice a day.
And then make sure you're drinking plenty of water. I'm thinking alkaline water, the water we said would be the best thing for you. So the dizziness is caused by the flu itself. It's not the medication. And it's the reason that you're also having nausea, it is a byproduct of the flu as well.
Okay.
But make sure you stay hydrated, so Gatorade or something like that, because as you throw up and everything else, you're going to become dehydrated, which will make you worse off. So make sure you're keeping plenty of fluids in you.
So when people get stressed out and have too much stress on, does that make them puke too?
Absolutely. That does weaken your immune system. Very good question. Yes, sir, it does. So those of you watching out there, stress can affect your immune system.
Okay, good.
Okay. All right. We thank you for your call, Mr. Joshua.
Very good question. Yes, sir, it does. For those of you watching out there, stress can affect your immune system.
All right. So did you get that, sir, to answer your question?
Yeah.
Vitamin C and D, plenty of fluids. And continue to take your cold medicine, too.
Yeah, I was just wondering about other things, too, like, masturbation. Does that cause you to lose hair and cause you to stress out more, too, or?
What does what, sir?
Masturbation, does that cause you to get stressed out more and lose hair?
I think that would relax you more than anything.
Is that it would?
I would think so. I don't think that'd stress you out.
Get stressed out more and lose hair? I think that would relax
All right, sir. We thank you for your call, okay?
Okay.
All right, thank you.
Bye.
All righty, bye-bye. All right, everyone. We've got Linda on line 3. Welcome to Pharmacist on Call. Miss Linda, how may we help you?
Oh, okay, good. I hope you're doing good tonight.
I am. Yes, ma'am.
I am taking Mobic or meloxicam
Yes, ma'am.
for my arthritis in my knees, and sometimes the one Mobic 7.5
Uh-huh.
does not really cut it for the pain. What can I really take? I've had different people tell me different things. Acetaminophen, or is that like Tylenol, or what can I take? Ibuprofen or what? What should I take?
Okay.
I need a little extra.
Okay, first, let's find out what we have going on. So what have you been diagnosed as? Arthritis?
Well, I've got arthritis, and I need to have 2 knee replacements.
Okay, are you bone on bone, or are you just...
It's bone on the inside on both knees.
Okay. Meloxicam, I'm not necessarily a big fan of. I would probably, and it goes up to 15 milligrams, so you actually could go up on it. Is it a case where you were getting some relief, and then over time it just does not work as well as it used to?
Well, the original prescription was 2
Okay.
a day, but then when I changed physicians, they did it just to 1 a day.
Okay. Were the 2 tablets helping you?
Well, yes, but my knees have gotten a whole lot worse. I need to have knee replacements, but
Okay.
arthritis is just, I'm sitting here with 2 bed buddies on my legs right now.
Okay. Yeah, well, you can do a couple of things. The first, you can either switch to diclofenac, whose brand name is Voltaren. Ask your doctor about that, or ask them about naproxen. Actually, it's my favorite anti-inflammatory medication. I think you'll get a better result from those 2 than you will meloxicam. In terms of acetaminophen, Tylenol, absolutely useless, and I would probably consider it malpractice for any doctor to recommend that for cases of arthritis or any kind of joint pain, because it has no anti-inflammatory effect. Even though they brand something Tylenol arthritis, it's really deceiving you.
Okay.
And they'll probably give me a call at the store tomorrow, the Tylenol company. But yeah, no, acetaminophen has no effect in terms of inflammation in the joints.
Okay, now what was the name of that medicine that you said I should take?
Diclofenac, D-I-C-L-O. F-E-N-A-C. The brand name is Voltaren.
Okay, Voltaren, okay.
Yeah, and it's probably a 50 milligram tablet. The other is naproxen, or Aleve, but it goes in a prescription strength up to 550 milligrams. And if you don't have anything like acid reflux or bleeding ulcers, I think those will probably be a little bit better for you.
Okay, well, I do take omeprazole, so...
Omeprazole, okay, yeah, so you do have some acid reflux.
Yeah.
And then, of course, a lot of my patients who have arthritis and gout are getting benefit from Kangen water, which I'll talk about, in a second here. So it's alkaline water is going to reduce the acidity in your joints, especially in your knee area. So you could probably get some benefit from that as well.
Okay. All right. Well, I may give you a call at your pharmacy
Yes, ma'am.
and talk to you about that. But does meloxicam or Mobic cause liver damage? Because I have to have. They want me to have blood work done every 6 months.
Okay. I think that they all have the propensity to damage the liver, even Tylenol. Tylenol, naproxen, all of them, just because of the way that they're processed through the body. Liver and kidney damage. Now, do you have hypertension as well?
Well, I take my blood pressure usually with taking 15 milligrams of lisinopril. It's usually about 128, 130 over 80.
Okay, that's pretty good, because the anti-inflammatories they can cause an increase in blood pressure, but it sounds like yours is under control even in lieu of meloxicam. So I would ask your doctor, he can go up to 15 milligrams on the meloxicam like you were taking it first.
Okay.
B, switch you to, the diclofenac or the naproxen, or then C, add on the alkaline water on top of either one of those that your doctor chooses to give to you. Because you want to reduce or increase the pH in your joints.
Oh, okay. Well, thank you so much. Sorry I took up so much of your time, but
Yep.
about had it with my knees and the arthritis and the joints.
Okay. Oh, no, I apologize, ma'am. I'd be remiss if I didn't mention a natural product, turmeric, Turmeric, which is the curry spice. So,
would you believe I bought some turmeric last night at the grocery store?
yes, ma'am. Yeah, try that out for size.
Okay, so you just put it on your food or add it to water? Or
Yes, ma'am. Or a capsule if you have it. Yes, ma'am.
Oh, okay, good. Well, I'll try that.
Okay.
Okay, thank you so much.
Yes, ma'am. You're welcome. All righty, bye-bye. All right, everyone. We are up on another break. Stay right there. Call in with those questions and comments.